According to the World Health Organization, global adherence for self-administered medication stands at 50%. In other words, half of those with long-term disease and illness take their drugs, and half do not. As a result, more than half of all visits to the doctor and half of all hospital readmissions occur simply because someone didn't take their pills. Drug non-adherence is the #1 cause of waste within healthcare today. Treating non-adherent patients costs twice as much as treating adherent ones. This equates to a global waste every year of over €600 billion in avoidable healthcare expenditure. And in the EU alone, an estimated 194,000 deaths as a result of non-adherence to prescribed medications. It's time for change. CuraServe is a pioneering technology that directly addresses drug non-adherence in patients with chronic and long-term illness. The leading cause of non-adherence is simple forgetfulness. CuraServe addresses this by sending non-standard text messages to remind patients to pick up their prescriptions and take their drugs. Initial studies show that 98% of patients who respond to their reminder also take their drugs, while a digital dashboard enables them to benchmark their own performance against others. We make a donation to the patient's nominated charity for every response they send, encouraging them to engage with the technology and thereby raising funds for research. CuraServe enables the doctor to monitor patient adherence rates remotely and in real time, increasing patient well-being while reducing waiting times. If the patient is non-responsive, CuraServe triggers an early warning system of escalating alarms. By receiving the data in real time, the doctor can identify high-risk patients and intervene before a problem occurs. Family and friends can now take an active role in care, receiving alerts that provide a safety net for their loved ones. So CuraServe keeps patients taking their medication, not hospital beds. It's all about connectivity. A two-way data flow creates a real-time connection between patient and doctor, which connects hospitals, community nurses, pharmacies, family and friends, all from a simple text message. Uniquely, CuraServe connects its data to the health service database and so forms a valuable new dataset. This dataset enables doctors and healthcare providers to benchmark performance by drug, demographic or doctor. By increasing adherence, CuraServe improves decision-making, improves patient outcomes, and drastically reduces hospital admissions. And with our unique text, app and voice technology, CuraServe can connect to 100% of patients 100% of the time. We have identified key disease classes with immense cost-saving opportunities. For example, in the UK's National Health Service, £9.8 billion a year is spent on diabetes care. According to a recent study, 80% of this is wasted on treating complications related to non-adherence. Now more than ever before, governments and healthcare providers are looking to make significant savings. Global drug spending continues to grow, but so too do healthcare costs. With proper adherence, a small increase in the cost of drugs can cut healthcare costs in half. And trials have shown that text message reminders can increase adherence by at least 30 to 37%. In 2015, Sir Bruce Keogh, the NHS Medical Director, called for mobile phones to connect with new technology to create a revolution in healthcare. CuraServe will be at the heart of that revolution. An investment in CuraServe is an investment in better, more affordable healthcare. Improved adherence, improves patient outcomes, improves healthcare, saves money, saves lives. The sound of a mobile phone has become part of our world. Isn't it time we got the message?